Well, hello everyone. Hello everyone. This is Deidre Kindred, your nurse advocate, and tonight we're back with Health Chats Among Friends. And this evening I have the true pleasure of talking with my good friend, Dr. TJ Patel. So, Dr. Patel, say hello to everyone.
Yeah, hi. Hi, Miss Deidra, and hello to all your audience. Nice to be with you today,
Well,
uh,
it's
and
great to have you. So,
and
Dr.
looking forward to chat with you.
I am looking forward to this as well. So, Dr. Patel, tell us a little bit about yourself. Who is Dr. Patel and what do you do?
So, let's say, I think many people, they know me as a doctor of physical therapy. So with my wife, have a group called Supreme Rehab Group. So we employ many physical therapists, occupational therapists, and speech therapists, and we provide services to home healthcare companies across state of Texas, and now we have launched in Arizona. So that is the main business that we are in. But then I'm pivoting towards my technology ventures, my startup, HomeCare2Go, where I'm spending significant amount of my time and resources bootstrapping the digital marketing and digital outreach platform, making everything simple for the patients and family to find the right kind of resources, and on top of that, helping marketers get the leading edge marketing whatever business that they are representing in front of the case managers and the workers across the country. So I kind of, let's say, have dual identity. So I'm kind of 8 hours a day clinician and 8 hours a day technology entrepreneur.
And then you got to
So
have some time to be a dad and a husband.
yes, so all that happens in that other 8 hours.
You're
Time to
running out
sleep.
of hours.
Yeah. So yeah, like let's say I think that's the way it has been in last 3 years. But to be honest with you, like let's say I don't feel tired. There are so many things we are doing. Very blessed with a team that I'm supported with. But the main thing is when you are trying to do something that is transformative, you just don't feel fatigued.
That's
So
awesome.
so
That's
so that
awesome.
that's the way I am feeling.
Yes, that's awesome. I love it. I love it. I love it when you find a purpose and you're passionate about it. So, home care to go. So, it's more like having access to resources at your fingertips.
Correct. So, like, let's say I will just define HomeCare2Go as a digital marketing and outreach platform that engages 3 points of care pyramid or care triangle. The top part is patient and family, okay, and the bottom right part is the healthcare professional. That includes marketers, clinicians who are representing business, who are owning business, and then there is another left side of the triangle is called uh, let's say businesses, so insurance companies, hospitals, healthcare systems. Uh, People who are pretty much running the healthcare business, taking care of their insured members. So, what we are trying to do is we are trying to make it simple for healthcare professionals to get in touch with case managers, social workers, anybody who is influencing the discharge process, the referral process, where all the information about their business that they represent is readily available. What insurances that they cover, what counties that they cover, what kind of skills they can able to provide. And on top of that, if they have any kind of question, our premium feature allows any case manager to connect with any marketer uh, to pretty much like do the phone call and video call, and all this is done using the mobile application, and case manager is not exposing their phone number, their private phone number in front of anybody. The marketers are not able to not exposing their phone number in front of the case manager. It is all professional. Whatever you chat, whatever you call for, whatever you video call for, stays encrypted. Like let's say after the initial one message, the entire conversation uh, for lifelong just gonna be encrypted. So we never have access to two people communicating on our platform other than the first message, where we will be able to find out that okay, what kind of interest it is and what kind of question it is, and then pretty much once the other person responds to that question very first time, then pretty much then on the conversation is encrypted. So for an example, I can be a case manager and
Mhm.
you can be a marketer representing a home healthcare company.
Okay.
So I will be looking up the information that, hey, I have Aetna patient, Aetna HMO patient. Patient is living in some part of Collin County. Patient has this complicated wound. And I
Right.
found out that your company can able to take care of that patient. Now, under your company, your profile is listed. So, Miss
Okay.
Deidra Kindred, the sales and marketing director for XYZ Home Healthcare Company. Now, I simply have to tap on your information and I will be able to read, I will be able to get direct chatting privilege with you. So I
Okay.
can just start chatting with you and I never even have to text to you on your cell phone. It is all happening on the phone. So let's say if I'm texting you, hey, how you doing? I have this patient. Maybe you can help me. I can be writing 3 4 sentences, okay, and pretty much explaining, okay, what I'm looking for. And when you are responding, yes, I can help. From that time onwards, our system creates that conversation, like flags that conversation kind of native conversation,
Mhm.
because then there is the interest on both end. So now our system will encrypt that conversation after those initial two messages, okay, for lifetime. So now if you are sending thousands of messages to that case manager, okay, we
Mhm.
don't have access to that. So all that conversation is fully encrypted, fully private, and so do the calls and video calls. So you will be able to, once your conversation is encrypted, you
Mhm.
also have access to the call and video call. So you can talk to each other,
Wonderful.
because like let's say you can't just like text everything, because sometimes it is just too lengthy to explain it to somebody. But then what happens is with the call and video call, you can see each other, you can talk to each other, you can network, you can communicate, you can build better relationship. So all these features are there. So we have
Wonderful.
evolved long way. We used to be like let's say resource platform, where we used to be having bunch of companies listed on our platform.
Mhm.
So
Mhm.
we outgrew, like let's say that part of the business, where right now we are having around about 450 companies on our
Awesome.
platform. We
Mhm.
represent 450 companies in 42 states. And then now through these premium features, we are making it so easy for case managers and social workers to connect with the resources, where they don't have to feel obligated texting from their cell phone number, because sometimes that's the only way. Because if you
Yeah.
have somebody's visiting card and they got their cell phone number there, the only way you can communicate with them is by calling their cell phone number,
Mm.
or you will be messaging them. And if you are calling them one time or messaging them one time, pretty much your information is there in that with that person. And then that pretty much like causes like a lot of time unfriendly conversation, uninvited conversations and things like that. So we have
Right.
made it
Right.
such a user friendly feature, okay, for that whole communication piece of it. And then you can freely communicate. Everything is encrypted. You can just talk whatever you want to talk, and all that is available right now for free. So even we are giving away our premium membership as we are growing. And we are just like let's say increasing our offering, and we are not even charging anybody anything. So any
Wow.
of your listener representing any home healthcare company or any kind of post-acute healthcare business, we represent 13 different categories. So they can make a note, they can download their app, they can have their company sign up. Once their company is signed up, they can able
Mhm.
to tag their company, and then automatically their profile will be shown under their profile. So you
Okay.
can be you can be working with XYZ home healthcare company, but
Mhm.
XYZ home healthcare company never signs up okay, then what happens is Miss Deidra Kindred won't be having any identity. Your profile will not show up under any company.
Okay.
So like, let's say we don't want to be a platform like Facebook and
Right.
Instagram, where
Mm-hmm.
you are your own identity. So we are much more refined and professional, where you are attached to your company, okay, because you are representing somebody. Okay, you are not business by yourself. Like sometimes it can be a scenario that, okay, you can be an RN, okay, a startup company, you can be the administrator, you can be the DON, you can be
Mm-hmm.
the sales and marketing person. All roles is pretty much, like, performed by you. But but like, let's say, still your identity will be attached to your company. So we are very, very focused on having all the employees, the key employees, the sales and marketers, the clinicians, everybody listed under the company. So
Right.
then patients can be able to reach out to them with their questions. Case managers can be reaching out to the marketing people with their questions. So we have created it in a comprehensive way, where we will be able to kind of help this patient with whatever need that they have. So for an example, the director of physical therapy can join,
Mm-hmm.
and somebody like me have specific question about my father's physical therapy. I probably will not talk to the sales and marketing person. If I see director of physical therapy or director of rehab is sitting there under the company, I will just reach out to them and I will just say that, hey, do you guys have any specialty program under the Parkinson's disease? And then me
Okay.
as a director of rehab, I can answer that question confidently and accurately. Like, let's say, marketers can too, but then it is always up to the consumer that, okay, how they want to kind of, like, let's say, get the better trust, right? So
Mm-hmm.
so if this patient or family will talk to this particular person, they will feel assured and they will feel confident making the decision, having their father and mother use that home healthcare company, because now they already had a conversation with their director of rehab that, yeah, we do offer those specialty program and we do offer that care that you are looking for. And on top of that, our backend team can able to also verify that, okay, we are able to accept your insurance, and then we can help you out.
So
So even, yeah, go ahead.
I'm sorry. So I definitely see the rehabs and the home health companies. What about hospitals? Are they letting you in to help their social workers or case managers? That's a big hurdle
So
sometimes.
so like, let's say we added board member in our company, and we are making a strategic conversation with a lot of healthcare systems, a lot of influential groups, where right now we are focused on building a content. So if we have content, if we have user-friendly and engaging apps, so this is a mounting task. Like what we are able to do
Yes.
has not been achieved by anybody, where
Mm-mm.
we are enterprise level software, but then super accessible to even patient and their family. So there are a lot of platforms that really simplify post-acute healthcare, but none of those platforms are available for free for the public consumption. We are the
Right.
only one. So
Right.
that gives us that significant edge over our peers, where we have dual role. We want to simplify that discharge and decision making process for the case managers and social workers.
Mm-hmm.
However, we also want to simplify patient and family, where like, let's say, in evolving healthcare, they should be savvy shoppers for their own care.
Mm-hmm.
But then
Mm-hmm.
how they ever can be savvy if there is no software or
Right.
data platform that can give them accurate understanding. So like, let's say, so pretty much it works like, like, let's say, you pretty much doing everything by yourself, and then to top it off, you are having access to the marketers and the clinical team to answer whatever question that you
Yeah.
have. So then truly you are engaging with your customers, okay, who want to use your services in a non-obligated way, and just giving them the comfort and confidence in making the decision, choosing your company or your providers on top of other competitors.
So let me ask
So,
you this. So I know you said it's a pyramid. So I definitely understand the marketers and the social workers, how they. So let's say that I am a daughter and my mom's in the hospital and they gave me a that list, they give you that list of Medicare facilities. How could a layperson who has no clue, how could they use your platform?
like let's say that just gonna require a lot of work building up the awareness. So for
Okay.
an example, I will just give you a quick example. For an example, Medicare.go has a list of 8 different categories that
Right.
includes all providers that has contract with Medicare. Pretty much everybody
Mm-hmm.
in the country has contract with
Right.
Medicare.
Right.
Medicare is the
Mm-hmm.
largest insurance company, right? But then if you will see how many people are able to make decision off of their platform, how many people are shopping care off of their platform,
Mm.
like they're spending huge amount of money
Big
to
time.
educate people, and then all these are government money, government resources, so they take a significant amount of their time and resources to educate the people, but still they get into this mess. Okay, because what happens is when your house is on fire, none of the strategies work.
Mm-hmm.
Okay, so what we are trying to do is we are trying to proactively engage these people. We will be drawing Betty's daughter, Betty's son much early into our app,
Good.
like let's say rather than when Betty is in the hospital, because when
Right.
Betty is in the hospital, then it is already too late.
Yep.
But how we will be able to kind of showcase them. So we are answering your question. So we are in conversation with some large employers where
Okay.
we are going to simplify their employees uh, parents healthcare need.
That's awesome.
So now they don't have to worry about taking time uh, helping their mom and dad. All that can be done through an app. They
Mm.
can just set up an appointment with any kind of marketer or liaison, ask them all kind of question, go into very specific detail, and then make that uh, confident buying decision, shopping for their own care.
That's
so
awesome.
so that's
Yeah.
so that's the direction we are trying to go. Like let's say the smarter healthcare not gonna become or nobody gonna be able to achieve smart healthcare unless and until the consumers are smart.
Yeah.
Because if consumers are able to understand and the decision makers are able to understand, okay, what is the difference between star rating, what is the difference between in network, out of network, what is the
Mm-hmm.
difference between like specialty care and normal care,
Right.
what is the difference between board certified program, what is the difference between accredited company and not non-accredited company. So if consumers not gonna able to understand all this, and the decision makers up in the alley not gonna able to categorize their choices based on these key features, then everything is just gonna stay as it is, right? So
Mm-hmm. Right.
frustrating, non-satisfactory, opaque, and to be honest with you, very frustrating, right? like
Mm-hmm.
like let's say right now after the COVID, uh, 2/3 of people who are uh, not able to work, the number one reason behind they are not able to work is because they have to take care of their parents, they
Yeah.
have to take care of their elderly, they have to
Yeah.
take care of their sick and like disabled kids. So all these things can kind of uh, streamlined if you have right kind of providers working for you. So when your mother and father is sick, all you need to have is the best of the best people coming out and taking care of your mom and dad, rather than like let's say playing the guessing game that okay, are they doing the
Mm-hmm.
thing, like let's say are they even coming or not, Okay,
Right.
like let's say I did not spend time vetting them, and now I'm having bad experience, but what should I do? Should I drop the ball? And like let's say the whole 9 yards, right? So
Mhm.
my main goal under the home care to go software is how we can able to give this transparency of all the information and quick and encrypted accessibility to anybody to ask right kind of question, because when you ask questions, what happens is you get the answer.
Yes.
But if you are not even getting an opportunity to ask the question, if your experience is always going to be like, okay, call this 1-800 number or call our office number, and we
Right.
will see who can help you. We will figure it out. Yeah, it's
Mhm.
just gonna take us 10 minutes, but we will figure it out. Like,
Yeah.
why can't I schedule a call with the marketer for 10 minutes, okay, on her comfortable time and my comfortable time, and then we can just have 10-minute conversation and we can help each other out.
Love it. I love
So
it.
that's the direction we are trying to go.
Well, I am definitely going to be following you and making sure that we keep people updated and informed. That's what this is all about.
Yep,
So, for marketers and lay personnel who are at the top of the pyramid, and then the caseworkers. So, it's
correct,
all about working together. And your resources are very much vetted. And I love the encryption. I
correct.
love the encryption. So,
So,
makes
and
people
then
feel
we
safe.
are we are working on some automation where all of our resources will be updated, and then we will be able to notify each and every app users about necessary notifications. So, for an example, you can be a marketer and I can be a case manager, and I just added you in my resource network, okay, just because you taken care of one of my patient that I referred you in a very good way, and they put good words about you. So now I want to work closely with you. So now what happens is you will be kind of part of my resource network. So whenever I'm doing the search, whenever I'm finding the provider, your company is going to be part of that because I have chosen you. And for that, I have chosen the company that you represent part of my resource network. And and the biggest takeaway for the marketers is, uh, like let's say they got to be understanding that there has to be a good mix of strategy that they have to come out with. I think like there is always an opportunity to mix and mingle in a much better and professional way face to face, but you still have to kind of respect your time and resources, and especially case managers and social workers time, where you can able to engage with them, get all your business done remotely, and still make them feel like you are always on top of everything and you are always truly one click away.
I like that.
So like let's say, and all that is able to be achieved by the app, and we are launching some new modes also. So this
Okay.
summer we are launching some modes. I think that is going live by 4th July. So we are going to work on some automation where you can be a you can be a case manager sending me a text. I can be a marketer in XYZ home healthcare company, and then you don't know that, okay, because you are not my Facebook friend or you are not my personal friend. We are just professional friend, and you don't
Mhm.
know my all whereabouts, and I am on vacation in Europe for 15 days. Now our app is going to tell you that, okay, he's on vacation mode, and he have left you this note. So it's gonna say that, hey, thank you for reaching out to me. I am in vacation with my family for next 15 days. If you have any urgent needing my assistance, please go ahead and reach out to my colleague XYZ at this phone number and this email. So this person can really enjoy their vacation, and
Right.
and you are rest assured that you will be pointed in the right direction, so that way you can facilitate whatever needs that you have with the another person. So we
Wonderful.
are so we are we are launching available. mode. So available mode is the regular mode. Like let's say most of the people are always available, but then there will be two other modes: not available, okay, and on vacation. So not available can be, like let's say they can be up in the meeting, okay, maybe they are just helping, like let's say patient, they are attending, like seminar, some sort of other things. But then, like let's say even vacation mode, where you will be out for some significant amount of time, and most likely whatever will be given to you, either it's gonna cause distraction in whatever you are doing, and then you're not gonna able to put
Mm.
timely response. So you are just saying out loud to your resource network or your referral network, that hey, I'm on vacation, I won't be able to be assistance for any of your question. Just reach out to my colleague. And all this
Right.
is using the power of technology.
That's
So
awesome.
so all this is going to be so useful to the community in general. And then, like let's say, just gonna simplify that communication, making it much more streamlined and professional, ultimately helping these patients and families getting their loved ones back to their home, or back to wherever the next level of care is.
Wonderful. Well, you got a lot going on. It's like it's just building and building and building. So that's wonderful. So if I'm a marketer or a case manager or even a layperson, because some people, lots of the audience that listen to this podcast are lay, how what is the best way they can get in touch with you to find out more about the changes that you're implementing and how you're going to change healthcare?
So the easiest and fastest way to reach out to me is on LinkedIn. Like let's especially people have LinkedIn profile, so
Right.
they should able to kind of, like let's say send me a invite, or just shoot me a message. I'm extremely responsive there,
Hmm.
and I can just answer their questions. And then about our product and about our website, everything is listed on our website. So it is very, very user friendly. We have put ton of
Yeah.
work. We hired best of the best people, vetted everything, good UI UX, where we are getting consistent feedback from everyone that okay, they have seamless experience without any kind of hiccups. So they are able to sign up by themselves, and then they can carry that user ID and password even when they are downloading the app. So if you will go to our website, there is a place where you will put down your phone number. Our system will automatically gonna send you a link. You click on that link from your message, and it's gonna help you help you download our app. You put your credential there, whatever you used on the website, and then you
Okay.
are live on the app. And on app, once you are on the app, we are putting so much updates together,
Mhm.
where we are going to educate each and every feature. So we are launching a new feature called HomeCare2Go Events. So
Oh,
so
okay.
so so there is a big confusion right now. If you happen to be living in a big metroplex, there can be thousands of
Yeah.
events happening every quarter, okay, that probably gives you an opportunity to network with like-minded people and really grow your business. But but after a certain point, it just becomes very, very overwhelming keeping up with everything,
Mhm.
maintaining that time balance, not wasting time,
Right.
kind of
Right.
falling through the cracks of social media and everything. So we have created this platform. We're going to call it HomeCare2Go Events, where what we are going to do is we're going to scrape every kind of event that has healthcare influence, as a speaker, like let's say as a vendor. We just going to put all those events together under our platform, so you as a user, you have access to each and everything that can be possibly happening in the entire metroplex. All you have to do is RSVP. Okay, yes, maybe not going. And
Mhm.
now that host will get your information even before you show up to that event, because each professional has their own
Yeah.
profile
Yeah.
into our application. So now you will be getting uh, messages from them that hey, I really appreciate you are joining me on this particular event. Please spend 5 minutes with me. I really want to chat with you. rather than, like let's say just getting a surprise that you showed up on that event
Yeah.
and not giving them any opportunity. So I've been to so many of these events, and like let's say the networking is the main key for the event. But then a lot
Mhm.
of times what happens is people are not even able to go and talk to half of the people who are actually attending the event.
Right,
Okay, because
right.
that's the way events work, right? Like let's say you name me one person who will collect everybody's business card. Okay, like let's say everybody tries but everybody fails.
Right, right.
So the way we want to achieve that is, if you are a host, you will be having that information ready to go even before
Okay.
your event starts. Like many conferences do. If you go to any national level conferences, okay, their marketers and vendors are reaching out to you months and months before
Yeah.
you are even showing up onto that event. Okay, so most of the times your meetings are set, your deals are done, okay, your lunches are scheduled, your dinners are scheduled, and then that's when you can make powerful presentation to people who can really influence your business, your referrals, okay, your whereabout in healthcare. But then like let's say all that is not happening right now with lot of micro events. So
Right,
we are trying to
right.
kind of change that. So that is HomeCare2Go events. So HomeCare2Go events is available right now, but we are going to put more features into it, and
Okay.
then it is going to be publicly accessible to anyone, including patient and family. So
Wonderful.
if 2 3 home healthcare companies want to get together and set up a health clinic, then
Mm-hmm.
they can
Mm-hmm.
invite all our app users through our platform, and they can pretty much come there for checking their blood pressure and doing all sort of like health checkups. And then they will be able to see what these companies are able to provide in terms of service portfolio to their patient, family, or community, or their loved ones.
Wonderful. And for the listeners who cannot see your lovely T-shirt, can you just verbalize your website?
So our website is very simple, homecare2go.com, whatever way you want to write it, TOGO.com or number 2go.com.
Good.
Basically, it will drive you to the same website. And our mobile application is also HomeCare2Go, and it is available on both Apple and Android store. We update our application frequently, I would say, like let's say very least once a month. So anybody using our application, we just request them to pretty much put our application on most updated version to get the best experience, because we are growing fast, we are updating our systems
Yes.
fast. So we just don't want you to leave behind with anything that has came up, and you are not able to access it just because you have not updated your app. So feel free to even put our application on auto update, so then your app store and your Google store can update it for you as soon as you are close to your Wi-Fi internet. The app will be just updated and you can have seamless experience. But we got lot many things coming up. I'm looking forward to kind of catch up with you maybe early part of the next year or later part of this
Absolutely.
year, and I will showcase all the updates that we have. And like let's say we are getting consistent spike in our user base, people who are signing up on our platform, and now we are pretty much like let's say taking it to the next level, engaging employers, engaging healthcare systems, engaging insurance companies to pretty much collaborate with us, use our
Wonderful.
platform, and do greater good.
That's awesome, Dr. Patel. Well, thank you for your time. And again, I thank everyone for tuning in to our presentation tonight, where we bring you reputable resources in your local communities. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And I love bringing you reputable resources in your local communities. Tune in next time when we have another amazing guest. Thank you again, Dr. Patel, for your time.
Thank you so much.